Okay, now we're live. So we really
Okay.
hope that people can hear us and see us the way we're hearing ourselves and seeing ourselves. But
Yeah,
so
I
welcome
can.
back. Welcome back again, guys. Sorry about that. This is your host, Adetila Dende, and of course our lovely guest, Dr. Tolu. Dr. Tolu Bintu, right?
Binotu, yes.
Binut Binutu.
Yes.
So how do you spell the that's not the way you spell it on your Instagram, is it?
No, it's Binotu. I noticed it, but I don't want to say anything. It's
Or
Binutu.
Binutu.
Yeah, there's a U somewhere there. It's a common mistake people make. It's fine.
Mm. I'm sorry.
No, it's fine. I mean, people call me Tinubu, so Bintu is still
Oh,
better.
yeah.
So,
Well, I'm sure you prefer Tinubu, won't you?
no, actually, I prefer. If I don't want to be called
You
Tinubu
prefer your
for.
name. You prefer your
Yeah.
name. We all prefer our names. Yes. Okay. Binu too. So yeah, so we're back with Dr. Tolu Binu too. And we're hoping you guys it's much better. We're hoping you guys are seeing us and hearing us. So we're going to go a little back to where you're based and which is UK. Your background is Nigerian, and you've been practicing doctorate for about 8 years now.
Yeah.
And then you decided to eventually, after going left, right, and center, to go more into psychology,
Yes.
psychiatrist. What do you call it? Like what do you call it? So,
Psychiatry.
psychiatrist. So, and I was now asking you, why did you decide to eventually land on being a psychiatrist?
Okay. Can you hear me?
Yes, thank
Oh,
you. Yes.
good. Okay, so for psychiatry, I think um, that's a good question. Before I came to the UK, I had no intention of studying psychiatry. In fact, what I had in mind was maybe I would go into internal medicine, right?
Yeah.
Internal medicine, those are the guys that deal with core medical conditions like, let's say, diabetes, hypertension, leprosy, tuberculosis, those kind of stuff, right? So I thought that was what I was going to end up with. But eventually, I took up a job in the UK. The job offer I got was in psychiatry. So I thought, okay, you know what, I can do psychiatry and then maybe after a year of doing it, because the contract I got was for a year. But within that 1 year of doing it, I actually found that I like psychiatry. You know, it was something different. It was something, and psychiatry is an area of medicine that a lot of people either do not know much about or they know a lot of wrong stuff about, right? So it's
Mhm.
usually one of those two things, especially in Nigeria. So I saw that the way psychiatry is done here is quite different. Like it's worlds apart from what I saw in Nigeria. I mean, what I saw in Nigeria, you have someone who is raving and then they tie the person to a bed and you can hear the screams along the corridor. You're like, oh my God.
Wait,
What?
is that medical
So,
or spiritual?
you know, those kind of questions now start coming to your mind. Then, of course, relatives will come with Bible, they'll be throwing olive oil on the person. So, I'm like, am I sure this is what I want to do? So, but here I found out that, okay, better facilities, better medication, better approach, better, they even have mental health law. They have like
Yeah.
there are provisions for those with mental health conditions, right? So I fell in love with it and I said, okay, I think this is what I'm going to do.
Mm.
And now that I'm doing it, I am also trying to educate people online. Like yesterday, I did a post on, anxiety and
Mm.
telling people about anxiety. And then I found out a lot of people sent me DMs that, oh, this is what they are going through. They did not know it was a mental health
Mm.
condition. They also did not know that, it can be treated. When you think that, okay, this is just my portion in life, I just have to deal with it. Meanwhile,
Oh,
you
back
don't
and
have to
free.
deal with it.
Mhm.
Yeah. So yeah, I think one of the things with psychiatry is I can help people to understand mental health
Mm.
conditions better. And, a lot of people go into medicine, surgery, pediatrics, OBGYN, but I think I think psychiatry is the way to go for me.
That's super. We need more of that, definitely. So kudos to you into sticking to that one. I guess it's much more complicated. So maybe I feel that's why a lot of people kind of run away from it.
Yeah,
And it's still like it's always a learning factor when it comes to that. So it's scary. But kudos to you for deciding to dive into that path, especially.
thank you.
So well, while we are on this whole subject when it comes to depression, anxiety, um, can you shed like a 1 minute light a bit more? You know, the fact that we're Nigerian, we will focus a bit more on Africans, right? Just
Yeah.
because the way we process things and the way we reason is quite different from the rest of the world. So when, of course, I believe that's what you do when you are giving out the information, professional information, you're giving it to attract everyone, but taking the fact that Nigerian blood is in you, you will tend to attract a lot of our people because there's a twerk, there's a way you would do it that it will resonate, we would understand. So I'm going to give you like one word or a sentence, and we're pretty much just going to do like a 1 minute topic. We're going to talk about it for like a minute, and we'll jump to the next one. So since we started with the anxiety, let's talk about hypertension, PTSD. Um, give us more information on it.
Ah, okay. So you want me to give you more information on mental health conditions?
Pretty much, in a way that a lot of, like you just mentioned, a lot of people don't even realize that they're going through that. Or like you just mentioned, a lot of people think it's like, oh well, this is my portion, or it's my village people that are after me. So how can they reason that in a proper way and find solution to the issue at hand?
Okay. Um, let me put it this way. I will I will mention common symptoms
Hmm.
that people have that they don't know this is a mental health condition.
Hmm.
And then I'll tell you the mental health condition that it most likely is.
Okay. Yeah.
Scenario one, a 25-year-old woman who hates men. Not now, let's say she's one of the men as scum um, school of thoughts.
Hmm.
And then the reason why is because maybe when she was 6 and 10 years, she was repeatedly sexually abused by a relative, let's say a cousin that came to stay with her and her family when she was growing up. And these days, she has nightmares that wake her up. And the nightmares usually have to do with this thing that's happened. She's never told anybody about it. She once told her best friend. The best friend said, you know what, don't tell anybody or else they would, label you as,
Hmm.
damaged goods. And so she's kept it to herself. But because of what the cousin did to her, she's repeatedly having nightmares. She wakes up suddenly. If she comes near a man, it irritates her. She gets irritated. She gets angry. She's become a feminist, you know, but for the wrong reason. There's nothing wrong with feminism, but for the wrong
Hmm.
reasons. And then she's angry with men, and then she's very quick to castigate. What that may point to is a condition called PTSD.
Hmm.
Post-traumatic stress disorder. Now, when we hear PTSD, we think more in terms of a soldier went to war and then is waking up now with nightmares of war. That's, yes, like a classic case, but PTSD actually has to do with anything that caused significant trauma and you keep reliving that event, including the traumatic experience, including the associated pain and fear and everything. Especially, it keeps coming to your mind when you don't want it to. Many times, when you are near the trigger, in this case, maybe the cousin or in the room where it happened or something like that, PTSD. Then another one is if, as a woman, if you are, and I'm using women for this one because this condition is more common in women than men. So you find yourself afraid, your heart racing, you are fearful, you are trembling, shaking, headache, stomach pain, but you can't point to anything in particular that is scaring you. It just comes almost like a wave and then goes. And sometimes it lasts longer, sometimes it doesn't. And then you're having this agitation, almost the way you feel. when you are in an exam hall or if someone has a gun pointed to you, but there is nothing that you can point to, that could be an anxiety disorder. These two things I just described are very common. Then let's move to something like depression, which is probably the most popular mental health condition, but also one of the most misunderstood. Everyone thinks that depression means sadness. Depression does not mean sadness. Depression is far more serious than sadness. In fact, depression has to do with low mood that has been sustained for an abnormal length of time. Then we begin to suspect that this thing is not just this person being sad. Because, we all get sad at some point, right? But with depression, especially depending on the degree of depression, the person may now start being reclusive, start staying away from friends, may not enjoy things they used to enjoy, and those kind of things. And then depression is quite complex, but this is just like a simplified view of depression. Then you have those who like to be the life of the party, who spend a lot, who want to talk. They don't have filter. They find it hard to sleep. They're always, let's say, like if it's a man, he can keep his wife up at night with gist, and then you go and then going about spending money, buying things they don't need, just hyperactive. That could be something called mania or hypomania.
Hypomania.
What I describe is more like hypomania. When it comes to mania, there's usually an aggressive aspect to it. The person may just become violent, lose that kind of thing. So mental health conditions, we talk about something being a mental health problem when it starts to affect the person's quality of life, because in the end, each and every one of us are to an extent deviated from the ideal mental health state. What that means is when people say everybody has coin, there's an element of nobody is, everybody has gone through something. So it's only when whatever your experiences starts to affect the quality of your life, your daily activities. Like when I explained the PTSD, I told you that it was affecting her sleep, affecting her the way she was viewing men. When I explained anxiety disorder, and also, being afraid for no reason. And, if you are always that worried or scared, then you will start at some point, you won't be able to focus anymore and concentrate. So that's when we say that, okay, you need to get mental health, you need to get help for your mental health when it's starting to affect your life.
Okay. You guys, I hope you're taking a pen and a paper and you're jotting these things down. And if they're not doing it right now, don't worry, you can come back and watch later and jot things down. Okay, now let's now go towards what do you call it? Dealing with a loss of pregnancy, because that also believes some people do deal with that as a PTSD. But there's a specific name for those who did not lose the pregnancy but eventually do have the children or the child, the baby, but they still have this mental issue they're still battling with. What do we call that?
Okay, so the first one you said was those who are dealing with, let's say, loss of pregnancy.
Yes.
And then the second one is those who develop mental health conditions after pregnancy. Okay. Let's start with the second one. So there's something called postpartum. There are some mental health conditions that are postpartum. What that means is postpartum, after pregnancy. Two common ones are postpartum depression and postpartum psychosis. So postpartum depression is when, and this is common, right? It's more common than you think. So with that, it's depression that's, like the name suggests, depression that comes up after pregnancy or after childbirth. Yeah. So you find women who maybe after they give birth, they just feel sad, they feel inadequate, they feel like they are not good enough to take care of the child. The things that used to make them happy are not making them happy. The husband wakes up and finds her holding the child and crying, or any small thing. Maybe when she wants to breastfeed, the milk is not really coming out. She starts to lament that she doesn't feel adequate, that she doesn't think she can handle this stress. And everybody is wondering that, what is really going on here? And then some people who do not understand, because one of the common reasons for insensitivity and careless statements like we usually see online is when you lack knowledge.
Mm.
So in this case, the man's, let's say it's happened to the woman, the man's mother may now start seeing this one as, this one is inadequate. It's like, this one is not happy that God has blessed her. Say this one can raise my son's child. Then the woman's mother may even also start to feel like, Kemi, Kilon Shele, why are you like this? Are you not happy? Do you want, don't let your child. So and then what now happens is, because this woman does not know what's going on with her, and then she cannot trust anybody else because they seem to be judging her. And they seem to, think she's ungrateful, maybe she cannot handle the stress of life, not knowing that this is actually a mental health condition. So she now keeps it to herself. And then the problem with keeping a mental health condition to yourself is you are not likely to, get better if you don't seek help. And so it gets worse. You understand? And then it becomes a self-fulfilling prophecy because she has believed she cannot take care of the child, and everything, the poor way with which it is handled now makes her unable to take care of the child.
Mm.
You understand? And then there's what we call postpartum psychosis. That one is not depression. That one is when after, having, and they can go hand in hand, by the way, depending on how severe the depression can lead to. What is psychosis? Psychosis simply means a detachment from reality. So they are the ones that, tend to see things that are not there. They tend to hear voices that are not there. What we will say village people are after this person is it can be a mental health condition. And
Yeah.
then they tend to, so those are the kind of women that, some of them may even end up killing the child.
Yeah.
Because, they are looking at the child as maybe like this is like a demon that it's just a twist in their reality. And these two classes of people with mental health intervention, they can get better. Now, as for women who have lost pregnancy or lost a child during childbirth, it is one of the most painful things that anyone can go through.
Yeah.
For both the woman and the man and the family by extension. So many times what they end up with is depression, low mood, depression, and even some level of PTSD. And that's why, we need to talk more about mental health because, any life altering event, a death. In fact, someone once did a rating, like to scale to talk about life events that are very likely to affect someone's mental stability. And I think top of the list there was death of a loved one. Then the next was divorce. So you see that those two things have something in common: separation from something you once loved.
Yeah.
So any kind of separation, and when you now talk about maybe losing a baby, that's a separation from
Yes.
something or someone you carried for several months within you. So yeah, so that's it.
Wow. And besides, like, we do know right now, the social media is at most people's beck and call, is on our fingertips. So the advice you would have for most people is to do what? Just pretty much search it out, search symptoms to know if that's what they're dealing with, and then look for doctors who can medically advise them and diagnose them. Would that be the advice of how to come out of it?
Now we're talking about all these conditions, right? The best
Mm-hmm.
way to approach them.
Yeah.
Okay. Whenever I talk about mental health conditions on my page, I usually end it by asking people who are going through stuff to send me a message or send me a DM. While I usually charge people for maybe if someone is having vaginal discharge and you want me to treat you, I almost like, but I generally for mental health I do it free. Reason being that um, now if let's say we are looking at a place like Nigeria,
Yeah.
we don't have a lot of mental health specialists
Specialized. Yeah.
in terms of psychiatrists, psychologists, um, mental health nurses. We don't have many, right?
Mm-hmm.
And even those way, and the problem with when we don't have many, the ones we, I mean, I think in the whole country,
Mm-hmm.
I don't know, I don't think we have up to six. If you add federal and states, I don't think we have up to 10 psychiatric hospitals in the whole Nigeria. That's why if you go to somewhere like, that place where I hate this name, Yaba left, you find it really crowded because apart from that place in Lagos, every
Yeah.
other place you may go to, I don't even know how many we have in Lagos, but I know that is like the major one, and that's the only
One.
federal. Yeah,
No.
so exactly. So luckily, and several people are good having NGOs and private facilities
Yes.
that okay, someone's asking an interesting question. Anyway, so yeah, facilities that can help, right? And some of many, let me not say many, some of them are online. At least I know of three
Mm.
that I tend to refer people to, right? If I realize that they need therapy, because there are some mental health conditions that may not require medication if
Mm-hmm.
you start treating it on time. For instance, we usually classify something like depression into mild, moderate, and severe.
Mm-hmm.
Mild depression may not need medication.
Mm-hmm.
With talk therapy, you can get better. Even anxiety, if the anxiety has not crossed a particular threshold, with therapy, you can be fine. So what I usually do is I have a conversation with them and then I refer them to services, right? So the reason why I do this, okay, yeah, someone said we have one in Abeokuta. I know there's one in Abeokuta. I think there's one in Abuja. There's one or two in Lagos, but not so many. So the reason why I do this is because I know that there's a shortage,
Mm-hmm.
and I try to fill in the gap, even though I'm online. But I try to fill in the gap to the extent to which I can.
Okay.
And yeah, because if I now say that maybe someone should have to go to Yaba left, just the doctors there are overworked and the place is understaffed. And the thing is, you cannot get the best access to care if which one doctor knows that is going to work, is going to see like 100 patients. He's not going
Yeah.
to spend a lot of time talking to you.
To you.
And in the end, the purpose of going there is almost defeated. So
Wow.
yeah.
So how do you deal with such psychosis, even after a lengthy time?
Okay, so like I said, psychosis has to do with a detachment from reality. And psychosis itself is not, how do I put this? Psychosis is just part of, okay, let me explain it this way. Take for instance, when we say anxiety. Anxiety itself is not a problem. Anxiety is a natural response to anything that stimulates your sympathetic nervous system. So that's what we say fight or flight.
Yeah.
Yeah. So but it becomes a disorder when it is happening in an abnormal fashion. And then I'll still come to psychosis. I'm using anxiety to explain something. So when we say anxiety, PTSD has an element of anxiety. Phobias, those that are afraid of spiders, those that are afraid
Yeah.
of closed spaces, those that are afraid of, you can have phobia of almost anything.
Everything.
Exactly. So there's an element of anxiety there. Even in a lot of depressive cases, there's an element of anxiety. So it's just like that with psychosis. For instance, when we say psychosis can be drug induced. For instance, those that smoke cannabis, weed. I get this question a lot, that is weed as bad as tobacco? Depends on who you ask. Because when we talk about tobacco, right? When we talk about tobacco, we are thinking more in terms of your physical health. Tobacco is linked with at least 12 types of cancers. Tobacco is linked with heart problems. You get smoking it, nicotine, all those things. Yeah.
Yeah.
So, but when we talk about weed, cannabis, marijuana, it's different names for the same thing.
Okay.
Personally, I'm usually more concerned about the effect on mental health, because smoking it can lead to something we call a drug-induced psychosis. That means you smoke it and then it causes you not to know what is real and what is not real. So those kind of people present with anxiety, aggression, They're the ones that, they say that the person smoked to a level, the brain now, that the what, there's a way they describe it that, the person's brain has knock.
Okay.
What they're describing there is, the drug has gotten into the brain and has distorted the person's reality. That's with drug-induced psychosis. Many times with treatment, the person can get better within a few days. But when you continually expose yourself to weed, it can then move from a drug-induced psychosis to what we call schizophrenia. Now, schizophrenia is a very serious mental health condition.
Yeah.
Yeah, you don't want to get there. You don't want to get there because I don't even think it can be cured. I think it can just be
Exactly. I mean, is
managed.
there a way back from that?
So, going back to that question now, dealing with psychosis after a lengthy amount of time. First thing is, what is the mental health condition that is presenting with psychosis? Like you see, I've already mentioned, drug-induced psychosis. I've mentioned schizophrenia. We also have schizoaffective disorders. We have we have schizotypal types. So there are different types. It depends on the most important thing when dealing with psychosis is a diagnosis,
Okay.
right? And then after a diagnosis, then we'll be able to know exactly what to do about it. Many times it requires the use of antipsychotics, of which there are two different types. So let me just see. I'm already going on. I know the short answer is you need to see a psychiatrist. Let's just leave it at that because
Go and see a psychiatrist that will break everything down for you. That
yes.
you pay for to break everything down for you. Okay, on a more lighter note now. Okay, what do you think or what do you see when it comes to the social media now is bad. Like when I say it's bad, all these ladies, even some men, they're all on this slim tea, green tea, something tea. So far as it's tea, helping you to break down the belly fat or the misbelief that is breaking down some belly fat. Waist trainer, and how some believe it's killing your organs, and some is like they can't leave the house without it. What is your take on that? Does the waist trainer, does it work, or is it all just all for fab? It's all the most of them have done surgery and they're just coming to sell us markets.
Okay. Why do people wear waist trainers?
To feel like to look slimmer, to give that figure eight that you want.
Okay, so they wear waist trainers because they have fats, abdominal fats, or truncal obesity. Okay.
Yeah.
How did they get? How did they build fats? There, what happened?
You're eating and you're not exercising, no, what does
So if the thing that made our dear men and women, because some men wear it, whether you believe it
yes,
or not.
yeah.
In fact, there was a rumor that was going on that a very popular governor in our state was wearing, in our country was wearing it.
Yeah,
Anyway,
our governor.
I don't want to call anybody's name. So, waist trainers, waist trainers are not, they are not new, right?
No.
They've been there, just bearing different names,
Yes.
right? We know that in old Victorian societies in England, and they wore corsets, right? Yeah, and then they tighten it and then it gives that shape.
Yeah.
So, but even they back then, they knew that wearing this thing is not going to. It's not like you are wearing it to lose weight. You are wearing it so that the outfit you are wearing to where you are going, it will fit and it will give you that shape. Because we've always been obsessed with that snatch waist, right, for time, maybe today. So, now I don't know at what point someone sold the idea that wearing clothes can help you to lose weight. Clothes did not give you the weight or the big stomach. You not think that it's clothes that will take it away. No, like if you really think about it, it is what you ate. Right? For most people, for some people, it may be an illness, right? But
Yeah.
let's say for most people, it's what you eat. That means the thing that will help you take away that fat is also what you are eating. And then to an extent, exercise can also help as well. So my point is, the only way I see a waist trainer helping you to lose or to have a figure eight is because sometimes when you wear a waist trainer, because of the pressure effects,
Yeah.
if you wear it safely, it may reduce your appetite. Because you know that if you eat plenty, it will be your stomach and the waist trainer will be fighting like this. So
sometimes when I go into party, I can't eat, I can't drink.
You understand? So that's one way if I'm looking at it logically and scientifically.
Yeah.
But other than that, the waist trainer is not going to press the fat away. It is there. It's there. That's why once you remove the waist trainer, it will just be as if
freedom.
as if you open tap, everything will just go. So that's it. So, and then one of the things, waist trainers are not bad, and I try to tell people they are not bad. We don't need to demonize them. If you you know that you are there, you have love handles and big tummy. You can wear your waist trainer, go for your wedding, look, snatch, come back, but remove it. Don't now wear it to exercise. I tell people not to wear it to exercise because the thing with waist trainers is because of that pressure. If you are now exercise already comes with an increase in pressure. I mean, you are lifting if you are lifting weights, increase pressure. If you are doing squats, increase the abdominal pressure.
Yeah.
Now imagine the waist trainer pushing you like this, then as you're lifting the weight, it's pushing you down. So something is squeezing you like this, something is squeezing you like it's not a good. Your body was not built to handle that kind of pressure. You understand? So, and then many people may now come down with, because of the way they put it tightly, it affects their ability to breathe.
Breathe, yes.
You understand? Because in order to breathe adequately, we need our diaphragm. So this is where the chest is. The diaphragm is somewhere like, the diaphragm is like a canopy. So when we breathe, the movement of the diaphragm helps us to take in adequate amount of air and push it out. So when we squeeze this place, the waist trainer, that's why you notice if you've worn a waist trainer and it's been there for some hours, your breathing may change.
Yeah.
That if you try to take a deep breath, you feel some restriction. It's the waist trainer affecting your diaphragm. So imagine now exercise. I know when you exercise, you are trying to breathe because you need to breathe more air. It's just a bad combination. So if you are going to wear waist trainers, just wait for your event. Try not to keep it on for more than a few hours. Come back, take it off. Enjoy your life. You only live once. It's the truth. And then if you are really serious about losing that fat, it's either you watch your diet or just go and do your surgery and be okay. Yeah. But you see that waist trainer.
What about the green tea, the slimming tea, the orange tea?
So now there's this thing. There you go. Influencers, they do the most, right? Because many of them, we doctors, we know that it's surgery. We know. In fact, some people that buy their products even know that it's surgery. But there's a way you can lie to yourself. Okay, someone is saying the amount of time is to hold your breath just to enter. It's like Miss Folu has experienced this thing.
Yeah.
So with slimming teas, the same thing with waist trainer. There's a way slimming teas can help you to lose weight, but the truth is, it's even if it's going to help you to lose weight, it can help you to lose a minuscule amount. Like let's say you take something like green tea. Science has shown that if you take green tea if you take too much of green tea, it can affect your digestive system. But if you take it adequately, it can help you, especially if you are exercising alongside and you are monitoring your diet. Then they can all work together to help you to lose the weight. But if you just want to be drinking tea, thinking it will help you, it will help you. It can help you lose some weight, but it can help you lose some weight. But imagine if you are weighing 100 kg. And drinking green tea helps you to lose 0.5 kg. So you have gone from 100 to 99.5. Your scale will not even see it. You understand? So when people say that slimming teas can help you lose weight, for some of them, it is true. But the thing is, they don't tell you how much weight. You understand? So don't depend on slimming teas. Don't depend on weights, and then some of these things, they can actually damage. In fact, I've written articles on them. They can actually damage um, your insides, some of them. So, yeah.
Question: what kind of surgery? I guess for the
Ah,
abdominal area.
people do all sorts. I know people do some kind of, there's, this one they call tummy talk.
Mm-hmm.
The people do some kind
BBL.
of, liposuction and, yeah, just.
What's it called? The one that is it like a ring or something? The close something.
And so what they can do, sometimes the surgery is just about removing fats, right? And then
Mm-hmm.
some people, they remove the fat from here and then put it maybe in your bum bum.
I like that
So
one.
that's a win-win, bigger butt and
I
so
think that's the BBL one.
like
Mm.
stuff like Brazilian butt lifts, right? Then
Mm-hmm.
another
BBL.
type is there's a surgery for that, we can shorten your digestive tract.
Mm-hmm.
So that causes, because one of the reasons why we gain weight is because at different stages,
Mm-hmm.
gastric bypass, gastric,
Mm-hmm.
yeah, at different stages of the digestive system, we reabsorb nutrients. So
Mm-hmm.
if you can make the person's digestive system shorter,
Yeah.
it means that there is less reabsorption of nutrients, and it's those nutrients that the body reabsorbs. By reabsorbs, I mean it takes back into the body. It's those nutrients that now, if you don't utilize it, it can now lead to accumulation of fats.
That's
Yeah, so if you can do that gastric surgery, like the gastric bypass and bypass surgery, it then reduces the amount of time it takes. So that means almost like you're eating and then the food's just going. So you will tend to lose weight.
okay.
You understand?
Yeah.
But I would not recommend you just going straight into that.
Mm-hmm.
The best way surgery free is losing weight is 70% what you eat and 30% exercise.
70% of what you eat and
30%.
30% of exercise.
The truth is, to lose weight, you don't even need to really exercise. If you just want to lose weight,
Yeah.
the exercise is to tone you
Mm-hmm.
as you are losing the weight, so that you don't look flabby. Because
Yeah.
when you're big and you lose weight, your skin can be.
What
But
about the
the
treadmill?
exercise, the exercise part is to tone you while you are losing fat, while you
Mm-hmm.
are burning fat. But if you just want to, if you had to choose between the two, if
Yeah.
I had to choose between the two, I would easily go for um,
BBL.
diet. Yeah, the diet, the diet is more effective than exercise.
But then, okay, let's say you're on diet. How long does it take you to start seeing results? Or what
Okay,
are the
so
foods that you're not supposed to eat so that you start seeing results?
it depends. It's not really about what the food you eat and what you don't eat. It's about the amount of calories you are taking. Okay,
Calories.
have you wondered why people say when you want to lose weight, eat more vegetables? Should I tell you why?
There's no calories in vegetable?
Eh?
Or there's little calories in vegetable?
Exactly. Because I think for something like 100 gram
Mm-hmm.
of vegetables, the calorie content can be maybe like 20 calories. If you have that same amount of bread, white bread, the
Mm-hmm.
calorie content can almost be times 10 of vegetables. So for someone who maybe where you want to eat jollof rice,
Mm-hmm.
you eat maybe like, um, if you've not put 5 spoons, your spirit will not rest.
You'll be all right.
What you can do is cut it down from 5 spoons to 3 spoons. Then the remaining 2 spoons, put vegetable you like. Just make your own. You can shred carrots. What my personally do, I shred carrots, lettuce. By the time I do that, I will now put it by the side of the jollof
Mm-hmm.
and then eat it. You are eating less calories, and by the time you sustain this thing, what people usually say is if you are on the really big side
Mm-hmm.
and you start changing your diet within a week, you start seeing results. If you are not on the very big side, let's say you are on somewhere in the middle, let's say but you may need to maintain a healthy diet for like a month before you start seeing results.
Results.
But for
Okay.
those who are maybe like those who know themselves that they're always eating, maybe they're always drinking soft drink, eating meat pie. In
Mm-hmm.
fact, chocolate to be in their mouth when they fall asleep. You know that by the time they make some changes,
Mm-hmm.
they will see some fast results. Then they will get to a level where they may now need to put in more efforts to now move on to the next level. Like, you understand?
Mm-hmm.
So yeah, it depends. It depends on, you know, every human being is unique. But the truth is, you need to achieve a calorie deficit for you to lose weight.
Okay. Next one. Belly fat, as in like fibroids. How do you now know if it's not just fat you're dealing with or if it's fibroids that you have?
Okay, fibroid. I spoke to a gynecologist. I had a live session with a gynecologist, and she said something very interesting, which is true. She said a fibroid is like your body's answer to an empty uterus,
Hmm.
right? What does she mean? What she means is the way the womb is created to. Someone said, I lose energy when I don't have starch in my body. I think the person means carbohydrates. See, to lose weight, you need to eat carbohydrates.
Okay.
It sounds funny, Abby, because
Yeah,
people
because
usually say if you
you
want to
can't
lose
lose
weight,
your
yeah,
yeah.
people say if you want to lose weight, cut out carbs. It's not true. Because if you cut out carbs,
Mm-hmm.
you no matter how much you lose weight, you will go back. Because like this person said, he said, I
Mm-hmm.
lose energy. It's true. You will not. The main purpose for carbs is to give you energy to carry out your daily activities.
Mm-hmm.
So if you don't eat enough carbs, like those who go on keto diets, that's why I'm absolutely
Mm-hmm.
against it.
Oh, you don't
Because
like it?
yeah, because you will lose weight though if you do keto diet. You will lose weight,
Yeah.
but you will go back because you will just be tired. Life will be looking black and white in your eyes because you will not be enjoying yourself. It's true. What I advise people,
Mm-hmm.
and I do it personally, and it works for me. Eat what you like, right?
Mm-hmm.
But keep an eye on how much of it you are eating. Let me tell you, for instance, me now personally, I try to target a particular amount of calories that I eat per day. And so I space it out. I realize that one reason why a lot of people have weight is because it's not usually because of the meal per se. It's usually
Mm-hmm.
because of what we eat in between.
In
Like now,
between.
in the morning, you can wake up, eat maybe bread, you put butter, you drink milk, you do it down at 9. Maybe you now went to the kitchen to remove your charger. You now saw that you even have banana and granuts. You just take one banana, you take granuts. You have taken that banana and lasso is
Mm.
more than 200 calories. Granuts too, rich in calories. They are both healthy,
Mm-hmm.
but healthy does not mean that it is low in calories. There are foods that are healthy but are rich in calories.
Calories.
Healthy
Okay.
simply means that as you are eating it, you are
Mm.
not, eating bad things like bad fats and high cholesterol. You are not, but it is still high in calories. So
All
you
that
take your
banana
banana.
every day. I'm eating banana, thinking that yay, I'm doing myself
No, you
justice.
can eat banana. Oh. See, okay, let me still finish this one. So you take banana, you take granite, you are eating it, and then maybe when it's 1 o'clock, you
Mm.
go to the kitchen to drink water. You now see that you even have juice. So let me just drink water. You just pour maybe half glass. You drink it. You go. That juice of half glass you've
Yeah.
taken is like maybe another 100 calories. So see, banana 200. Granite, let's say you ate enough for 100 calories. That's 300 calories. Juice 400. Then maybe your sister now comes in. She went for party. She brought cake.
What the top.
You now say that because of this cake, maybe I should not eat lunch. I'll just eat only dinner. You now eat the cake. I know the way cake is. One bite is never enough. You will say, let me just taste it. From taste,
Mm.
you finish the thing. You've almost eaten the foil that they used to wrap it. That cake is like 500 calories. So you see, it's all these small, small things. So what I do for myself is I tell
Mm-hmm.
myself that, okay, um, I am going to eat what I like. For
Mm-hmm.
instance, I can wake up in the morning because I exercise, I lift weight. So I can wake up in the morning, I'll do my exercise.
Mm-hmm.
I'll check how many calories I've burned. And then after doing that, I'll take a protein shake, mix it with skimmed milk because skimmed milk has less calories. drink it. That one, I know that, okay, by drinking that, I've taken in like 200 calories. Fine. The thing about eating protein is protein tends to be very filling. So I may not be hungry again till like 11 or 12, right? And then by then I can now say, okay, what am I going to eat? I'll eat something rich in carbs because I know I need energy to carry out what I'm supposed to do that day. So I can eat something like rice, rice, salad, and meat. I like rice. I'll eat my rice. And nobody can tell me to cut rice. Cut rice. I don't have second life somewhere else. This one life, I will. No, it's true.
Must
I'll eat
enjoy
what I
it.
like. The only thing is, even before I used to take like 5 scoops of rice, I will now reduce it, like I said, to maybe 3. Put my salad. Eat what I like. Sleep. Wake up. Lunch. What am I eating? Eat lunch. All those things. If I'm going to eat something in between, I'll pick things that are low in calories, like oranges. While a banana can be up to 200 calories, one orange is like 45 calories.
Okay.
So I can just take an orange, peel it, eat it, and I'm fine.
Good.
Oranges are sweet. Nobody can be telling me I should not be eating. So I'll eat that one. This when lunch comes, I'll eat lunch. Also a reduced portion of lunch. Then usually for dinner, because dinner I don't want to eat heavy, so I'll not wake up with heartburn and all those. I can't be eating. I'll get so. I'll most likely just take yogurt. Many times I take yogurt, and then I may put some things inside and eat it. The yogurt I take, I usually go for the ones that are maybe like 300 calories in total. So by the time I do it like this, then of course I have maybe once or twice a week I spoil myself. I eat large amounts of ice cream because if you eat unhealthy food once, that's not what will make you gain weight. It's when you do it
Consistently.
then. Personally, there are some things I've cut out completely, like fruit juice, all those things, because I know that it's very hard to control how much of fruit juice you drink. You will say it does what half glass. That will be sweet.
It's not enough.
There's a way the devil used to do it. It's that half glass that will be sweet. You will take another half glass. You just see that you will shake the carton. Put the carton. You will now be feeling bad. There's no point to go. So usually I don't do unless maybe I now want to spoil myself. So by the time you do it like this, you find that you are eating what you like to eat, but you are losing weight as well.
Losing weight. So does Diet Coke really have 0 calories or 0 sugar content?
So Diet Coke actually has 0 calories, but there are some. Let me explain it this way. With Diet Coke, if you had to choose between normal Coke and Diet Coke, drink Diet Coke. But the problem, and this is what they don't say, this is what some research, I'm still not, I've read some research on it. And yeah, so this guy is saying one yogurt is 300. It depends on the yogurt. To me, I choose my yogurt. There's yogurt that can enter 600. To know how much calories, always check the back of whatever you buy. I can bring one now as an example. Should I?
No, it's okay. It's okay.
Okay, I should leave it. Okay. Yeah. So, the thing with Diet Coke is some research has shown that when you drink it, even though it's 0 calories, but there are some things it contains like aspartates and preservatives and co. And there has been noticed that when you drink it, even though it's 0 calories, your insulin levels shoot up.
Oh.
And insulin is what helps us to digest, is what helps us to break down sugar. That's why people that have something like diabetes, many times, it's usually they don't produce enough insulin, or the insulin they produce cannot do the job it's supposed to do. So when insulin goes, that usually means that, sugar too must have gone up. And then we've associated a sharp rise in maybe sugar levels and co to increased weight gain. So that means even though it contains 0 calories, it might be making you gain weight in a different way. So what I advise is, if you can, just stay away. If you must drink juice, make your own. Get a juice maker. There's a name they call it. And put your oranges. Use food. Yeah, that's what I advise. So I was talking about fibroid. Yeah. So fibroid is an abnormal growth from the muscles of the womb, right? And then research has shown that it's far more common in Black women. Like
Why?
way more common in Black women. We don't know why. Some people say maybe it's like our diet. Some people say maybe it's something in our genes. But we've just noticed that it's far more common in Black women.
Hmm.
So with fibroid, the first thing you should know is many women have it,
Okay.
but many times it is not big enough to cause problems.
Okay.
The ones that we hear about are the ones that is big enough to cause problems.
Mhm.
So when it's big enough like that, the fibroid can grow and be pressing on, your bladder, so it will make the woman not to be able to urinate properly or cause urinary symptoms. Sometimes it's located in such a way, although this is rare, it's located in such a position that it may affect fertility, but it is rare. I think only 2% of fibroids affect a woman's ability to conceive. But because there's a lot of misinformation about, and sometimes, yes, fibroid can cause painful sex, can cause heavy menstrual bleeding, but because of a lot of misinformation, many women may just do a scan, see a fibroid, and then they will associate all the problems they have been having to that fibroid. And they have the headache, all the that they don't have money, everything, they'll blame it on that fibroid. Meanwhile, it may not be the fibroid. So I usually advise women that, first of all, if you do a scan and you see something like maybe a cyst,
Mm-hmm.
or you see something like a fibroid, don't be quick to assume that it is that thing that is causing it. See a doctor, let the doctor tell you. Because
Mm-hmm.
many times it may not. Do you burn calories when you are just lying down? You burn calories when you are alive.
Period.
Because as you are alive, your heart is beating, everything. The problem is not just burning calories. The problem is many of us taking more calories than our body needs. And that's why we gain weight. So as I was saying about fibroid, when you do maybe a scan and then you see a fibroid, don't just assume that, this fibroid, they cause all my... No. Go and see a doctor, and then the doctor will let you know. Because, like I said, many Black women
Mm-hmm.
have it. Like you'll be surprised. Fibroid is almost like this herpes virus. Many of us have it, but it's just dormant because
Mm-hmm.
many of us have strong immune systems. That's why you find out that when someone has maybe a condition like maybe malaria or something that brings down the immunity, you start to see they form sores here.
Yeah.
That simply just means that you have the stuff, the virus within you, but because of that, your good immunity up until
Mm-hmm.
that point, you've not shown any symptom. But
Mm.
that thing that now made you ill now showed you. So the fiber is almost like that for women.
Okay.
So yeah,
And then, gosh, we hear it a lot. Fibroids. All these are herbal concussions or so that would help you, Does it really work? A lot of these are natural herbal
it
stuff.
doesn't work.
It doesn't?
It doesn't.
Yeah.
That's the short answer. I don't. Let me not beat around the bush. It doesn't work. Do you know why? Because even we don't know what causes fibroid.
Hmm.
And we are the ones that are studying it. We are not mixing agbo. We are studying it, but we
Yeah.
don't know.
No.
So what we've realized though is that fibroids are linked to the same things that make a woman um, a fibroid we notice that fibroids come within the reproductive age of a woman. So at the point, the hormones that make a woman flourish as a woman
Mm-hmm.
also feed fibroids.
Fibroids. Wow.
So many women, once they enter menopause,
Yeah.
whatever fibroids they have shrink because there's a reduction in their female hormones,
Yeah.
the estrogen. There's a reduction, and so it's like you're starving the fibroid, like you're doing keto diet for the fibroid. So the
Fibroid.
fibroid itself will burn low. You understand? But when a woman is within in a reproductive prime,
Yeah. That's when.
that's why many times when a woman is pregnant, the fibroid may be growing at the
Yeah.
same time that the child is growing.
Yeah.
Because the thing that is helping the child is the same thing that you understand.
Feeding the fibroids. Wow. So let's jump to yeast infection. Pretty much the vagina.
The vagina. Okay. Um, I've noticed that on Instagram, if I want a post to go very far, I just need to talk about the vagina. It will go far. It will go far. Anytime I notice that engagement is going down my page, I'll just think, what can I say about the vagina? Kidding with it. So can I'll just sometimes I even post something I've written before, it will still jam because the vagina is very important to both men and women.
Women, yes.
You understand? So yeast infections. Let's talk about vaginal care. So I did a post. One of the most controversial things that I've said online is women should not wash the vagina. And when I said, a lot of people came for me, a lot of people were like, oh, who's this fake doctor? Doctor, you want to pursue our husbands? And then I told them that you guys calm down. That
We're coming down. We're coming down.
yeah, be calming down. That the thing what you think is the vagina is not the vagina, right? So when you look at a woman, let's say she's standing naked in front of you, you see her private parts, right? You see you see that lower part.
Yeah.
The outer part you can see is not the vagina, it's the vulva. The vulva is made up of the labia, the woman's lips, the labia majora, minora. You have the clitoris, and then when you go down, you have where where the woman urinates from before you have the vaginal opening. Many people even think that when they urinate, it's coming from the vagina. In fact, some women think so. It's wrong. It's coming from the urethral opening. It's different from the vagina. They are close, but not the same. So after that vaginal opening, when you now go inside where the penis enters during vaginal sex, that is the vagina. And it is that canal, that tube that connects the cervix to the vaginal opening. That's the place that I'm saying women should not wash. You should absolutely, wash the outer parts. Nobody wants you to be carrying germs from year 2000 in 2021. We wash it, right? And when I advise that when women are going to wash that outer part, wash it with water. And if you must use soap, use an unscented soap. Because we found out that when we use soaps with fragrances and co, they can predispose to problems. So use soaps that don't have any scent, unperfumed, unscented soaps. The reason why I tell women not to wash the vagina, that's the inner part, and it's a process called douching. When they flush is because the way God created the vagina, God created. I tell women that when you wash your mouth, do you wash your throat?
No.
But if you don't wash your throat, do you have mouth odor?
You could if you're gonna have But it has
No.
nothing to do with your throat.
Let's say if you wash your mouth, and you wash it well, will you have mouth odor?
No.
Exactly. So that means if you wash your mouth, but you don't wash your throat, you still will not have mouth odor. Because all you need to have a clean good oral hygiene is to wash your mouth, your tongue, your teeth, wash it. You don't need to put your toothbrush inside here for your mouth to be clean. It's the same way with the vagina. If you keep the vulva, the outer parts clean, you don't need to go into the tube to be scrubbing what you don't know there. If you can keep just the outer parts clean, you will not smell. Because the vagina is made up of, that's the inner part, it's made up of good and bad organisms. And the good and bad live in harmony. I usually describe it like an estate. The estate will have bad people and good people. The estate may have thieves, but if the estate has good security, the thieves will respect themselves and there will be peace. But when you wash the vagina, what tends to happen is you tend to kill the good bacteria. So it's like your estate, someone just comes and removes the gates of your estate, and then all the Olode and all the OPC or whatever you use to protect your estate, they remove all of them. And the GPS they go. Thieves will just look that, okay, it'd be like, say, these people want to do Christmas. You understand? You want to do Christmas for them. They will come and rob you. So it's the same way with the vagina. If you wash it, you get rid of the good bacteria. That now leaves the bad organisms. The good bacteria is called lactobacilli, right? So when you wash them off, you then leave other ones like bad bacteria, like fungi. To thrive. When the fungi thrives, that's what causes yeast infection.
And
when
continue, sorry.
When the bad bacteria thrives, that can now cause stuff like bacterial vaginosis. You understand? These two things are not, they can be very annoying and sometimes difficult to treat infections.
Wow.
You understand?
So
Another thing that can
douching
kill.
is a no.
What?
So douching is a no.
Yes, Zeno.
And then there's this one that is steaming, vagina steam.
Don't do it. You don't need steam in your vagina. There's many pharmaceuticals and companies, because they want to sell feminine products, and
Yeah.
they now create in many women's psyche the notion that their vagina is dirty.
Mm-hmm.
So you find people putting yoni pearls, they will bring it out to be black. They'll now be saying, see how your vagina is dirty.
Yeah.
It did not get black because the vagina is dirty. It got black because the yoni pearl has chemicals that have changed inside your vagina. And in changing it, they've also changed your vagina. But when they see it black, and people be like, so now everything they inside my vagina.
My body.
The
Hey,
vagina is not
friends are
dirty.
putting all this feminine product and telling us pearls and everything.
Yeah, because the pharmaceuticals know that if they can convince women that their vaginas are dirty, all the women will start rushing their products.
Yes, now. So those pearls that you go in is all just scam.
You don't need it.
Yeah.
And the terrible thing is, when women change the organisms in the vagina and they start having this discharge, the discharge now makes the woman to wash the vagina even more because they want to remove the discharge. That washing the vagina now kills the good bacteria more, and that makes the infection worse. I've seen a lady who has been having vaginal discharge from GS3, and she's an adult now, and she has been having it all her life. Of course, you will know that she will stay away from men. She will not be comfortable. Yeah. All because she's carrying out the same process, because you want to wash it more to get it up. Meanwhile, you are getting the... So we need to let women know. Because I have women, in my DMs and who are suffering because they don't know these things. Another thing that can kill the good bacteria is, maybe we've noticed that in pregnancy, women tend to have less good bacteria, and so that's why I find many women with yeast infection, many pregnant women with yeast infection. Sometimes, maybe if a woman uses antibiotics a lot, I've seen this one too a couple of times. Using antibiotics will kill the good bacteria, especially when you don't use it in a prescribed manner. Let's say any small headache you have, you go and use amoxicillin. Or maybe you have unprotected... There's some women believe that if you have unprotected sex, bitter Mampiclox will kill the sperm. Knowledge is the problem in many of these conditions. So women now tend to use Ampiclox. You have unprotected sex 5 times a week. You use Ampiclox 5 times a week. Ampiclox, Ampiclox, as if your body is a factory. So when you are now taking it like that, the Ampiclox will be killing, because that's its job. If the Ampiclox goes into your body and it does not see any disease to kill, it will kill your normal bacteria. It must kill something. Medicine does not just waste in your body. It must do something. That's why we prefer to do tests. Let's see that there is something for it to kill before we send it. It's like a hired assassin must kill somebody. So when that now happens, you abuse it. When any of those women, or maybe this one is unfortunate, women who maybe were on hospital admission for a really long time for some condition, and then the doctor gave them a prolonged antibiotic therapy. Many of them now come down with yeast infections. So this is the reason why, because of the death of the good bacteria. Now, when women realize that, okay, I'm having this discharge, the first thing I try to do, before I even do anything, I'll first ask you, do you wash your vagina? Do you use a lot of antibiotics? Do you have any medical condition that can reduce your immunity, like HIV, diabetes? Are you pregnant? By the time you ask them these things, many of the women, they will tick 1 or 2 of these boxes. I educate them. Stop washing your vagina. Just wash your vulva. Keep it clean. Keep it dry, because fungus thrives in wet places. Keep it dry. Don't just use antibiotics anyhow, please, for the love of God and your body and your vagina. Don't use this. So by the time you are able to do these things, you then give the good bacteria time to grow back. Then there are a couple of things that you can take to help it to grow back, like probiotics. Yogurt has been found to, because yogurt is even made by culture. Bacteria make yogurt, so is even good for you. So yogurt can help to replenish this things. It may take weeks, it may take months, but I tell them to be patient. Don't just be throwing antibiotics. Then, if you know that you're having a discharge, diagnose it, because there are several discharges that resemble each other. Bacterial vaginosis, for instance, can look a lot like yeast infection. So if you have yeast and you think it's bacterial vaginosis, you're using antibiotics. What did I say? Antibiotics will kill good bacteria and make the yeast worse. You're not going to buy a stronger antibiotic. The yeast gets stronger. You just find that this is how your angels will just be looking at you, that waiting they'll call for you. You understand? So, see your doctor.
Oh boy. Wow.
Yeah.
So now this one that they say that some people have loose vagina, some people have tight vagina. One, is it true? And two, is there a way that your vagina loses its elasticity maybe after too much intercourse or pregnancy or something?
Okay. The way God created the vagina, He created in such a way that when the vagina is a muscular tube that expands and returns back, like if the woman is going to have sex, one of the things that can happen is it expands. That's why if she's not mentally into sex, maybe if she's raped, God forbid, it tends to be more constricted, and then the man has to force it. But if the woman is, wants the sex, it's not only her legs that will open, even her vagina will open for you. You understand? You are welcome. Yeah. So, that's where the vagina is. And when a child is going to pass, it opens so wide that a child will come out. A whole child weighing between 2.5 and 3.5 kg will come out. And after that, in fact, there are some things that will happen. Maybe it's designed in such a way that when the woman is breastfeeding, she releases some hormones that help the uterus to go back to its normal size. And not just the uterus, the cervix and everything with it comes back. So as the child is sucking on the breast, yeah. So that's one of the advantages of breastfeeding, by the way. So it can restore everything to, even if it doesn't restore it to the exact way it was, which sometimes it can, but it will at least restore it to something very close. That's why you find that many men, even after their children and their wives have 2-3 children, they enjoy sex with their wives because nothing has, changed. But then there are times where, like if a woman is maybe, and this is common with women having their first children, we may need to do, a procedure to enable the child's hair to come out.
They cut.
Where we cut, yeah. And then, with that, what the doctors do is we repair it afterwards. And there are even times where in repairing it, we can even help the vagina to be tighter.
Yeah.
I've done it a couple of, so there's a way you can even do it. So if indeed maybe the woman feels that her vagina is not tight enough, or maybe something has happened, maybe when they cut or something, you can always go to see a gynae. A gynae can have it done for you. But the truth is, first of all, these creams, stay away from them. Vaginal tightening creams, just stay away from them. I don't believe they work. Number two, most times the woman does not need to do anything to tighten the vagina is just fine the way it is. It's just fine the way it is. It may be a case of sexual incompatibility that is making her think, and then the man wants to blame the woman. It may just be that. Maybe you are not compatible with the person that you want to die on top. That could be it. But the truth is, many women that think, my vagina is loose, maybe after repeated sex, it will get loose. No, your vagina was designed for sex. It's like saying, after repeated eating, your teeth will spoil. Your teeth were designed to eat. Your vagina was designed for sex. So it will expand to accommodate the penis. It will go back. It's not a big deal. Now you they overthink this thing. So Yeah, that I think I think that's it.
Oh boy. Okay, then let's now jump into like the orgasms, the you know
It's like
squirting.
you want to discuss everything in this world this night. Now, wow.
Discuss, let's discuss. One more minute. So
Okay. What would you like to know about orgasms?
yeah, so is it okay to have intercourse and not have an orgasm? Or if you don't squirt, is it a crime? Is there a problem with you?
To be honest, it is okay to have sex and enjoy it without having an orgasm. It is. It is preferable, especially for a lot of women, to have orgasms. But then, for instance, if let's say you're having a quickie with your husband,
Yes.
you may not have enough because, especially for different women, some women take longer
Yes.
to have an orgasm. Meanwhile, some women, as soon as they even see the person that they love like this, man, if you should just touch them like this,
That's
or
it.
if you should just say hi, man, they can come.
Mhm.
So it's different. And
Yeah.
then with women, because I'm not going to really talk about orgasms in men because men, our own is like
You guys don't
straight,
get problem at
it's
all.
like expressways, just like this. So, but it's women that, they will tell you
Mhm.
turn left when you see this bus stop, wait small, your boss will soon come. It's women, it's real people. Anyway, so uh, with orgasms, I will focus more on women. With
Mhm.
um, there are different things to know. A woman can enjoy sex without having an orgasm.
Mhm.
A woman can ejaculate without having an orgasm. Then a woman can enjoy sex, ejaculate, and have an orgasm.
Mhm.
But there are three different things.
Mhm.
You can fully enjoy a quickie without reaching the very pinnacle and then having
Mhm.
an orgasm. You can enjoy a quickie where you get wet, but you don't ejaculate.
Mhm.
Like I spoke to a
Wait,
woman once who said that, okay,
please. Let some men know. You can get wet, but not ejaculate. Like it's two different things. Some people they believe that because you are wet.
okay. In fact, we even need to, when we say ejaculate, we need to look at it in two different ways.
Mhm.
The first is what we call squirting.
Mhm.
Now, squirting comes from the urethra. That's where urine comes from. So, a lot of people believe that squirting is just urine. Squirting, from some research I've read, it contains some of the content of urine,
Mhm.
but it's not fully urine.
Mhm.
And it usually comes when, a woman gets to, and it's not all women that can squirt. So, don't be beating, or don't be for trying to imitate your favorite porn star. Free your mind. You understand? So, but let me now explain what I mean by now. There was a woman that told me once that um, when she has sex with her partner, that by the time they finish, his penis will be covered with one white thing, her
Mhm.
vagina too will be white, and everywhere will be. And then I said, okay, when you don't have sex, do you notice this thing? She said, no. I said, what do you notice when you don't have sex? She said, it's a normal discharge. I said, and it becomes whiter only during sex. She said, yes. I said, that means your boyfriend should be happy. Because what that means is Baba has stimulated you to the point that you were coming, like you were having this your because that what that fake white discharge means that
Mhm.
she's into the whole thing that is going on.
That entered the
You
body.
understand? She's in the mood. Her body's in the mood. That means it's just, she's just.
Mhm.
So the man should be happy that this
It's
white
doing
thing
good
is
job.
my badge of honor. Wear it
Mhm.
on your chest. That okay, I sabi this work. You understand? Because some men may see it and they'll be like, what's all this? What's all this? That means you don't understand what is going on. Something you should be happy about. You understand? So
I'm scared.
that's what I mean by now. Of course, when a woman gets wet,
Mhm.
that is an ejaculate. So,
Mhm.
in a sense, you are right, she has ejaculated because her body produces those fluids to
Yeah.
enable lubrication.
Mhm.
Then there's the one where, that she enjoys it in a sustained manner, that the lubrication production is even increasing. That's what
Mhm.
causes that really whitish one. But that's what causes, you may even see that ejaculate will stay in the bed.
Yeah.
Then there is squirting, which I've described. Then there is an orgasm. With an orgasm, that means her sexual excitement has gotten to the very pinnacle, and then it causes a contraction of the vagina, of her muscles, of her thigh, even her brain will contract, because there's a way. You know what I'm saying now? Don't be. So there's a way to, you understand, to be as if you've reached heaven, doing things that you will come back. You understand? So
Please, we need to come back.
you need to come back. Because if you don't come back, you have died. You understand? So
Exactly.
so that's an orgasm, and then of course there are different types of orgasms. But yeah, that's a simple way of breaking these things down. Now, just to say this, for women to have an orgasm, it first needs to happen here. That's why it's more difficult for women who have been abused. Because if that abuse, like I said about PTSD, if that abuse, makes her to hate men, and no matter what that man does, no matter what a man does, if a woman is not in the right state of mind, you can just be there. It will be like you're starting a gen that fuel is not inside. You will be frustrated. You understand? And then a woman can be so into it, or she can, let's say she's into the act, she wants it.
Yes.
That the slightest thing the man does, will be looking like a superstar, because she has already started and finished the whole thing in her head. Women, everything starts and finishes within your emotions and your brain.
Yeah.
For men, is that act gone that can make them So you need to understand your woman, because there's some women that clitoral stimulation does it for them. Once maybe if you use your tongue or whatever is to stimulate the clitoris, they prefer it to even the vagina sex. For some women, it's not really the clitoris, it's the sex gone. For some women, it's their breasts. For some women, it's when you kiss them here or you put your tongue in their ear, then they'll start doing like naked wire.
Like
So and for some women, it's a combination of everything. For some women, it's even anal sex. For some women, it's anal sex. So it's different things for different women. So always, it's very important that a woman feels free with you, because that's when she may be able to, two of you be able to explore and understand her. Yeah.
Nicely put. Okay, we are getting towards the end. We don't try now. So, how do you know what is going through your body when your urine is different colors during the week?
Okay. So urine, very important topic. A lot of people think when urine is yellow that it means malaria. It's not true. Urine, normal color of urine is what we call amber. So that's like hold on. Almost something like this, right? Now, if your urine is looking like this, then it probably means that you are dehydrated. If your urine is looking more like this, that's normal. But if it now starts going into this zone, then you start suspecting, am I drinking enough water? Because you might not be. If your urine is now something like this, reddish, pinkish, it usually means blood. Unless you are now, there's some medication that can color your urine, make it look reddish or orange, like rifampicin, But, and then of course, if you eat beetroots, sometimes that might make your urine look reddish in some people. But if you're not doing any of these things and your urine is looking reddish and cold, then you should go see your doctor. It might be blood, right? And then if your urine is looking cloudy, especially maybe with women, then it could be that you have an infection, because like I said, where the urine comes out is close to where the vagina is. So sometimes it might push out some of, if you have any abnormality there, like a discharge, it might push out some of it and then look cloudy. So, and then if your urine is looking colorless, it is most likely normal as well. It just means that maybe you took a lot of water within that time. Like you notice during If maybe if you drink a lot of water and then you urinate within like 1 or 2 hours after,
Yeah.
it may not have any color.
Mm-hmm.
So yeah, those are the most important colors to know.
Okay, besides the one that you mentioned, like if it's reddish pink, go to the doctor. The other ones, is it just a change of diet most often that will bring it back to normal?
Yeah, if you, like I said, if you are noticing maybe something like this,
Mm-hmm.
like that thick yellow, everybody here knows what I'm saying. Then that's, like I said, dehydration. So what you need to do is increase your fluid intake.
Mm-hmm.
And then sometimes it may be because you are losing more water. Maybe if you are living in a very hot country, or if maybe you've just finished doing a very vigorous exercise and you
Mm-hmm.
did not drink water afterwards. But basically, what it just means is you need to drink water. You need to rehydrate.
Okido. Wow, wow, wow. Yeah, 18 plus now. Okay, the last is, how do you deal with snoring?
How do you
Deal with snoring when you're sleeping.
snoring?
Yes.
Ah, that's a broad topic. Okay. Snoring, right? So what happens first? We need to understand what happens when someone snores. So when someone snores, what it means is the airways, there is some level of obstruction,
Mm-hmm.
right? And that sound, that harsh noise that comes with snoring, is air struggling to pass through that narrowing,
Mm-hmm.
right? So what can cause the narrowing? One of the most common causes is obesity.
Okay.
Someone who is on the big side. When you notice that people who are on the big side tend to snore. Although you see some slim people too, like to be as if they have an engine in their, but obesity has been linked to snoring. Then sometimes it could be something we call obstructive sleep apnea.
Mm.
Like if you see habitual snoring in a child, usually children that are under 5 years,
Mm-hmm.
and then you find them habitually snoring, and then maybe they are asleep, then they may wake up, or just that's, and then during the day, because they did not sleep well at night, they may not be sleeping in school or sleeping in class, affecting
Mm-hmm.
their academic performance. Sometimes it even affects their development.
Mm.
That may be due to, just have that child checked by a doctor, because it may be due to enlargement of some organs at the back of the throat, called the adenoids and the tonsils,
Mm.
right? Sometimes they get enlarged, maybe due to some form of exposure to some organisms or infection.
That's why some
So
people always remove their tonsils, especially teenager. You tend to, well, it happens here often.
yeah,
Oh, I have to
tonsils,
go and do
exactly.
surgery and remove my tonsils.
So sometimes you may need to remove the child's tonsils for everything to go back to normal. And sometimes it affects adults as well. It's less common in adults, but
Mm-hmm.
adenotonsillar hypertrophy can also happen in adults. So that can also cause snoring, right? Now,
Okay.
another thing is those who maybe eat heavy before
Mm-hmm.
going to bed, and then when you eat heavy, blood goes to your digestive system to digest it, and then that's why I find some people after eating amala in the night, just go, and there's as if they have
They call it
almost as if they have
man's
died. So
disease.
they tend to snore, and then those who are really exhausted by the end of the day,
Yes.
you notice that I don't know about you, but me, when I'm exhausted by the
Yeah,
time I
really
go to bed,
tired.
there's a
And
higher chance that I'll snore. That
mm-hmm.
is normal as well.
Yeah.
Then those who drink lots of alcohol or use medication that
Mm.
has a relaxative property,
Yeah, in it.
like alcohol too does that, it can
Okay.
cause snoring. So basically, you need to see your doctor to know exactly what's causing
Mm.
the
Okay. And I know
snoring,
I
and
believe they
then your
do
doctor will
tests
then
and things
determine,
like
yeah.
that to know
Yeah,
which one.
doctor will now determine the best form of treatment.
Okay. Wow, you guys, I know we loaded you guys today. And sorry about the beginning, how the network decides to show himself. But thank you so much for your time. We're definitely going to, we're going to come back. We have to. There's just too much to talk about.
No
But
wahala.
we try to round it over as much as we can. But thank you so much.
All
His
right.
handle, you guys go follow at Tolu Bintu. What is your
Benito.
Binu 2? Oh my gosh. Tolu Binu 2, guys. Follow his Instagram
Yes.
page, TINU
See you.
T. You guys follow his Instagram page, and he has some great content up in there. You're definitely going to be entertained, and you will learn a lot of things. So thank you so much again. We'll definitely be reaching out to you. Either when we come to the UK, come say hello. You know.
Thank you for having me.
All right then. Thank you so much. So have a lovely, lovely evening,
All
and
right.
enjoy your Christmas and New Year's.
All right. You
All
too.
right.
Take care.
Bye.
Bye.
Say hello to the family. Okay, guys. So we know that took like a minute. It's not our fault. Network issues from the beginning. Do follow us. Subscribe to our channel if you ain't. Click the like button. Click the share button. Let's get more people into our channel. And don't forget to follow me on ade_babes on my Instagram. And yes, so I'm out. Thank you once again for all your comments, all the love. Love you guys. I'm probably sure we're going to still be meeting before the Christmas. But till then, enjoy your festive season and stay warm. For those who are in America, Europe, Canada, stay warm. And this COVID thing, Omarion or Ocarion, what do we call it? Try and stay safe, y'all. Love you guys. Have a lovely, lovely weekend ahead. Deuces.